watching SHEM Ministries. Souls honoring Elohim's mandate. And now for today's message.
Well, hello. Welcome to SHEM Ministries. And tonight is our SHEM Tonight. That is a spiritual, healthy, enlightening mandate ministry. And there it is. I thought I lost my ink pen. You know, some of us have to have a little whatever. I have to have a pen in my hand for some reason. Whatever I'm doing, something come to my head. I might have to write it down. So I couldn't find my pen and I was freaking out. But anyway, to God be the glory. Thank you, Lord. Thank you for another day that we have never seen before. And guess what? If you have not by now done anything that you felt was giving back, contributing to the will of God, maybe, because I'm going to tell you now, many times the enemy will bottle you up and keep you bound. And you have to break loose, right? Because by the end of the day, by the end of the night, whatever your night may be, by the time you lay your head down, I don't care how late it is right now, you still have time. You still have time to sacrifice, even if it's an hour. Check on someone you've not checked on. Pray for someone. Just stop, think, and meditate and give time to God. Okay? It may be 7, 8 o'clock at night, but the night is not over. Your night may be someone's morning. Glory be to God. So, Father, we thank you for this day. We thank you knowing that there's still much time left for us to give to you, even if it's just a word of prayer. And Lord, while we're making that statement, let us pray now, God, before we even attempt to minister to your people. Dear Heavenly Father, we humble ourselves and we give this fleshly body of ours as an empty vessel. We crucify the wants, the desires of the flesh, Lord, and we press toward the mark that you have for us on tonight. To speak a word into the lives of your people, God. Let thine will be done on earth as it is in heaven. And that is for us to do something that is edification, edifying your people to know more about themselves, how better to care for themselves. And if not you personally, participate in the care of others. So many times we keep silent. Ain't nobody, they don't want to hear what I got to say. Okay. Or we'll keep silent because of fear of rejection. I thank God my son did a talk. Probably about a month ago, I would say by now, about rejection. And his name is Minister Casey Kirk, and his ministry is First Steps. And he has been broadcasting, I think he broadcasted on Facebook, or he may have Instagram or what, but Minister Casey Kirk, First Steps. Google it. and he did a presentation. The Lord blessed him to teach on rejection. And I'm going to tell you, I was blessed. I wish I had my son maybe to have preached that word in my life 20 years ago. But guess what? He was only about 10, 12 by then. But it was a blessing to me. We fear rejection and we stay silent. And there are so many times we can speak something that will bless someone else and we won't for fear of rejection. Well, tonight, I thank God for my platform. I thank God for blessing me to be a part of SHEM Ministries. And we are going to talk about heart disease and high cholesterol, specifically high cholesterol. I have done many, many lectures on heart disease. I have lectured on heart disease in the African American woman. I've lectured on all kind of stuff with the heart. The third seat, the seat in our heart that God has, but the septum of our heart. We've done a lot of talk about that, but tonight I want to focus strictly on cholesterol, okay? And let's see, last couple of weeks, we talked about medications, this, that, and the other. Well, cholesterol medication is something that a lot of people fear, don't want to take. Much of it is the side effects that okay, true. Okay, I don't want to get ahead of myself, but a lot of people were told they had high cholesterol and they felt, well, I'll just cut back on eating fried foods and I'll this, and whatever. I'm going to talk to you tonight about the condition of your blood vessels when you have high cholesterol. It's like a silent killer in a sense. And most people who have high cholesterol have high blood pressure. So you put two and two together, right? And the odds are, if you have high cholesterol, because they are linked together now, right? There's a physiological happening in your body that the high cholesterol, high blood pressure, like, okay, which one comes first? The cholesterol is in your arteries and the blood pressure goes up trying to get blood through those clogged arteries. They may not be 100% occluded, but there's some narrowing there. So the pressure goes up to try to get the blood to pump through. And did the cholesterol go up because of diet and lack of exercise and being obese? Which one came first, but they're linked together. And then there's the link with diabetes and obesity and heart disease and hypertension. They're all there together. But we're going to focus on the actual cholesterol, okay? And so tonight's topic is an achy breaky heart, right? Heart disease and high cholesterol. An achy breaky heart. Cholesterol will make your heart ache and break. Yes, because it is the precursor to you having a heart attack. And this is what February is Heart Healthy Month. It is actually the American Heart Month, okay? It has been declared nationally a Heart Awareness Month ever since 1964. The prestige in regards to the heart health came, years later, especially when they started focusing on wear red the first Friday of, and I've got and listen, like I told you, I have presented on this so much. I pulled up some old slides. And so the date may be, let's see, here's one. This is from back in 2024, okay? So it's 2 years ago. Go Red, National Wear Red Day. The American Heart Association, it is the first Friday of every February, because, February isn't but 28 days, so except leap year. And so the first Friday is National Wear Red Day, and I believe I miss it every year, but I just wanted you to know that. And I'm gonna go ahead, and since we're talking about blood vessels, right? Let's go and let me show you arteries. And then we'll go backwards and talk about the cholesterol that clogs the arteries. And it's not so much as, it's a combination of the cholesterol and the wall, the inflammation, and all these things that cause plaque to form, right? Cholesterol is just one ingredient. So even if you are careful and cautious of your diet, you still have to do other things like not smoke and things like that. You exercise, moderate to intense exercise. You're supposed to get 150 minutes per week of exercise. And for some of us, it's challenging, especially if you work from home. But what I usually do, since I'm blessed to have stairs in my house, I make a lot of trips up and down the stairs, up and down the stairs. I may not do it as repetitively as I should, but I make it my business to walk up and down the stairs. And do not forget that we talked not long ago about our heart being a pump. And we said that the calves in our legs, right? They are the second pump in our body. They are what cause the blood vessels to constrict in our legs and pump them up, pump the blood back to the heart. So we need good, strong calf muscles. And that's why I said to you that even if you don't do anything but walk, it's better. Good gosh, better than nothing to just walk, even if it's slow walking. But the arteries, a normal artery, look at the lumen, the size of the normal artery, and then look at the narrowing, almost 50% narrowing when the artery has plaque in it. Okay. Well, if the plaque is calcified because it's been there so long, you know how it is. You have oil that solidifies and hardens at room temperature. You heat it up and it's liquefied. Well, and that's another reason why you really, 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 really need to avoid any type of cooking oil that is hard or not liquid at room temperature. For example, lard. Remember, we used to have Crisco. Crisco oil is what at room temperature. Then they, everybody caught on to how unhealthy these things were. And so they started, making and processing healthier oils. Okay. But I'm not going to get into the oils as much as other than to say, do your research and do the study on saturated fats, not just the total cholesterol in the oil, not just the trans fats, but the polyunsaturated and the monounsaturated fats. A oil may have no cholesterol, but we learned that the particles, the smaller particles, can contribute to clogging your arteries as well. So when we fry food, the oil is when you fry the food and you take for example, you fry chicken. You dip the chicken in some batter or some flour and you fry it. Well, the oil is adherent to the flour and that makes some good old crunchy fried chicken. Well, guess what? Yeah, it is delicious. But think about the oil that you just ingested. Now, even if the oil that you ingested in the batter that was fried on top of the skin that had cholesterol. But a good piece of fried chicken, I cannot say every now and then is, I think you can get by with that and you deserve to eat it. And just as long as you eat something else healthy with it that is going to transport and push the cholesterol that's in what you just ate through your arteries into your digestive tract. I'm just telling you, why do you think people eat a salad with every meal or just about? Or if you ever go to a restaurant, they offer you a salad. Eat the salad. Eat the good fats, okay? All right, so let's go to this other picture because I like this one too. I like the way this is depicted. Why you must keep your cholesterol in check. Now, and we're going to talk about the different total cholesterol, the LDL, the HDL. Remember, we'll go through. H is always happy, okay? L is not good. The LDL should not be elevated. You want your HDL to be elevated because your HDL is the happy cholesterol, the good cholesterol, which helps to bind up the bad cholesterol, the LDL. Okay. And now we monitor your VLDL, your very low lipoprotein. Okay. So I've got a chart for that and we'll go through that. But too much LDL cholesterol can lead to plaque buildup called atherosclerosis, narrowing the arteries and reducing blood flow. See, that is actually where the damaged blood vessels, okay, so say like you got a lot of plaque in your arteries. That's the reason why you're at increased risk of developing blood clots, stagnated blood, because the blood is going through slower. And when you have damaged red blood cells or blood cells, what happens? Thrombin is released when the blood cells, the platelets come because it's an injury. They're going through and it's kind of like, look at the cholesterol as a rock, a cliff. So you've got blood going through that's traumatized by the rock, the cliff, the plaque, and the blood vessel bursts open and releases all these particles and the platelets come. Oh my God, we got to stop you from bleeding. The blood vessel broke open. And guess what happens? A clot forms. And you may end up developing blood clots, DVTs, pulmonary emboli, right? So it's very, very important, especially if you have decreased activity, you are stagnated in which you do not walk much, or you don't get out and do this and do that. Understand it's even more important for you to have lower cholesterol, lower your LDL, and raise your HDL. And there are medications that do that, and we're going to talk about them. Okay? All right. So there's the other example. Now, let's go through this here. Because many of us, we get our cholesterol checked, and the doctor will say, well, your cholesterol is okay, or your cholesterol, it's better. Do you know your numbers? So look at this right here. You need to know your numbers, and you need to understand what those numbers mean, especially if your lifestyle is compromised by your level of activity. Also, if there is a familiar in your family of history of heart disease and dying young, okay? Everything is not diet. There are people who, and we're going to talk about it because I have a couple of pictures that I put in here. Where's her other picture? I thought I added it. Maybe I didn't. But I need to, so I'm going to pull this up while I'm talking to you. That this book that I it's called Health Monitor. And I have taught from this series of books for more than once. And this book in particular has a cover story about a nurse practitioner. Okay? She is a nurse practitioner that had high cholesterol, and it was in her family, and she was on medication. She couldn't understand why, like, what is going on? I can't get my cholesterol down, blah, blah, blah. Well, we're going to talk about that because it's not very common, but it does exist. So, do you know your cholesterol levels? This is a blood test. There's a blood test. It's actually called a lipid panel or a lipid profile, and it's a lipoprotein profile. It measures your levels of total LDL, total cholesterol, your LDL, and your HDL cholesterol. And here are the numbers and pretty much where we need to be. Number one, you need to be less than 200 total cholesterol. Now, in the past, if you were 200, they were like, just watch the cholesterol in your diet. They didn't go any further. But as time passed, people realized that, wait a minute. Total cholesterol is not what's killing you. It is your LDL cholesterol, okay? And so you see what desirable is less than 200, borderline is 2 to 239, and 240 and above is high, okay? The LDL cholesterol is less than 100 is optimal. And we got near optimal, above optimal, borderline high. So why is there more breakdown of the LDL cholesterol? Because the LDL is what's going to kill you. The LDL is what's going to clog your arteries, okay? So that's why they decided to break this up into several parts and let you know that if your LDL is above 190 or above, you are very, very, very high risk, especially if your total cholesterol is high, okay? And guess what? The good cholesterol, just because your good cholesterol is low, that is not good. It is a major risk factor for having a low HDL and an LDL less than 40. Now, 60 and above, guess what? It gives you some protection against heart disease. All right, let me tell you how you get your HDL up. Exercise. Exercise will get your HDL up. That's the reason why. And I mean, there's some medications that help as well, but exercise and medication, especially if you have an elevated LDL. All right. So I wanted to make sure we went over that. Now I want to show you this. Okay. And this is the big picture of it. And then we're going to do a close-up. So I hope you can see this, but if you can't, I'm going to read it to you. What's your heart health profile? So, you know, we always do these profiles. You need to do a heart health profile. So the number one thing on this worksheet is what we just talked about. Your total cholesterol, your LDL, your HDL, and your triglycerides. Now, let me tell you about triglycerides. You have to be fasting in order to interpret your triglycerides appropriately. So, if your doctor says, are you fasting? And you lie because you don't want to come back another day and get it done, that's not helping you. Tell your doctor, no, I'm not fasting. The total LDL and HDL will still be accurate. The triglyceride, they can interpret with caution and put non-fasting. Okay? Okay. Now, age and birth gender have a lot to do with this. So, and I'm not going to go through all the specific details other than to say at a certain age, your risk increases and a certain birth gender. They didn't put male or female gender. They said birth gender because some people change their gender after birth. Okay. But men classically had higher risk of heart disease. But guess what happened? Women climbing the ladder. I don't know if it is because women entered the workforce and started taking on the stress of working and raising a family where they used to could stay home and just take care of the home. And the husband did all the stressful work outside the home. I'm sorry. I shouldn't have said that. The manual labor. But now it's, anyway, there's a lot involved with lifestyle and changes in lifestyle. You remember years ago, women didn't smoke. And anyway, there's so many things that have changed. So then they start asking these questions. And I'm thinking, let me go ahead and put this up. Yeah, this is a close-up. Now, you can't see number 6, 7, and 8. But I will read them to you. So, number 1, has a grandparent, parent, or a sibling, which would be a brother or sister, had a heart attack or other heart cardiovascular event. Okay, so cardiovascular can be a stroke, not a heart attack. Okay, and it does even say that, such as a stroke, especially before age 65. Now, it used to be, I remember when it was in the before 60. But anyway, it's 10 years before that person had a heart attack. For example, if you had a family member that had a heart attack at 55, they're going to start screening you at 45, okay? Like a close family member. And so then you answer these questions. Do you smoke? Yes or no? If you quit, talk about your smoking history and the date that you quit. Now, I don't know if you remember me telling you how to determine your pack year history. So a person who only smoked 10 years, but they smoked 2 packs of cigarettes a day for 10 years, that is a 20 pack year history. A person who smoked 1 pack for 10 years is a 10 pack year history. So the years that it depends on how much you smoked. I remember one time I had a patient, I could not believe they smoked 3 to 4 packs a day. 3 to 4 packs a day. But they only did it for maybe 5 years. Guess what? That's a 20 pack year history. 20 pack year history increases your chance of heart disease, COPD, okay? All right, it's significant. All right, so pack years. Do you have diabetes? Yes or no? If yes, are you on medication? Yes or no? Now, let me tell you, for me, I have to say yes, but I always make sure I say pre-diabetes. But any type of diabetes does carry some risk and some factors that you have to consider. So for me, quite naturally, I'm going to push myself and make sure that my cholesterol is good. My total, my HDL, and my LDL. And I personally, even though my cholesterol was optimal, when my mom had a heart attack a couple of years ago, I decided that I wanted to be even more aggressive. And I switched medications so that I could have even lower total cholesterol and even lower LDL cholesterol. I chose to do that myself. Okay? So, you have to factor in your risk. And what are you willing to do? Well, guess what? I have always fought a good fight. Okay? I'm not going out without a good fight. And if I can do something about it, I didn't wait on my doctor to say, well, didn't your mom have a heart attack? Because all they're looking at is my numbers are good. I said, I want my numbers better. Yeah, they might have been optimal, but I wanted them very optimal. Not too low, okay? But on the lowest dose of a better statin, and we'll talk about statin drugs, but on a better statin, I did better, okay? Now, do you have high blood pressure? Yes or no? If yes, are you on medication? Because being on medication and well controlled actually will decrease your factor some. Still have to be mindful of it, okay? The next one is check any of the following cardiovascular events you have had. And I know it kind of cut it off, but the first one that one we're good. It says heart attack. TIA is a transient ischemic attack, which is a mini stroke. It's where you had symptoms of a stroke, but they resolved on its own. Then a stroke. Angina is chest pain, okay? Or other. There could be other cardiovascular events. But many times the cardiovascular event could be associated with like a mini stroke, okay? Number 6 I guess I can go back to this one. You may not be able to see it, or you might be able to. If you are on your phone, you can try to make the screen bigger. But number 6, check any of the following symptoms you have had: shortness of breath, difficulty, pain when walking. That's a sign of vascular disease in your legs, whether it's an arterial disease or vascular disease, or it could be what we call claudication. Many people develop claudication in their legs before it's like the precursor to arterial or vascular disease. Okay. And it's intermittent claudication. Next would be chest pain and fatigue. Now, easily fatigued. So let me tell you how you can test yourself cardiovascular. Walk up and down stairs. In the past, you could walk. Now check me out. Now listen to me now. If you haven't walked 4 flights of stairs in a while, please don't try to run up the stairs and don't think you're going to get short of breath or fatigued, because that's a given. But I'm talking about if you're used to walking 4 flights of stairs without fatigue, and you might have had just a little bit of shortness of breath, that's your baseline. But if you were able to do it and then all of a sudden you can't even get up 2 flights of stairs, that's a red flag, okay? Now, the average person, now I'm not saying everybody can do 4 flights, okay? But the average person can go up 2 flights of stairs without stopping. And that's normal. You might be a little winded, not winded, but you know what I mean. Breathing a little, you're not huffing and puffing, but you might increase your respiratory rate, but not struggling and having shortness of breath, okay? 2 flights. So these are things that you should ask yourself. And if you have tightness in your chest, okay, that is definitely a red flag as well. Now, there are some people who can take a bath, hot shower, and the shower causes vasoconstriction. Well, can cause that person to start having some chest discomfort. Yeah, you got to be mindful of that as well. So, shoveling snow, just any type of increased cardiovascular activity. Number 7, do you have sleep apnea or other sleeping disorders? Yes or no? A lot of people don't realize that high blood pressure is associated with sleep apnea. There's a relationship between the two. You get rid of your sleep apnea, you may get rid of your high blood pressure. Think about it. When you're not breathing and your heart needs more oxygen, or you stop breathing in your sleep, the blood vessels, everything works harder to get oxygen to the vital organs. So when something is working harder, then the pressure goes up, okay? All right. Number 8. Check any of the following conditions or procedures you have had. So this is just a screening. This is a heart health profile. And you take the profile and you keep it. Fold it up if you have to and put it in your wallet. If something happens to you and you pass out and no one can answer, having this in your wallet is a good thing, okay? Even if you have to, there's the things that we have now, technology, this is a good screening. This is excellent for someone to know about you if you can't answer. Share it with your family and your loved ones. The person who is your power of attorney or who would be your healthcare surrogate if you're unable to answer. Please, please, please fill out this information and share it with someone who is able to assist in making decisions for you. But have you had a coronary bypass surgery? Ding, ding, you definitely need to let somebody know. A stent procedure, stents in your heart, stents in your legs. There's other places they can stent, okay? Carotid artery stents can be placed. Let me tell you this. Anytime you have had vascular disease anywhere in your body where they had to do a procedure, it puts you at risk of other cardiovascular issues, okay? So a person who has poor circulation in their legs, the odds are you have poor circulation in your heart. You just never had an event that raised a red flag. But your risk factors are definitely there, okay? Surgery for circulation problems in the legs. Dag, I'm sorry. I didn't even read that. I just... Anyway, peripheral arterial disease, carotid arterial disease. Well, we touched on them, not even reading through the checklist, but we've already addressed them. Now, I'm going to go back to this slide so that you could see this is the information to tell your care team what prescription medications you're taking. Let me tell you something. I know we talked about this the last couple of weeks about medications. I can open up a patient's chart, scroll through their meds, and tell you what diseases they pretty much have without them saying. I can look at their meds and say, do you have, and they say, yeah. Do you have, yeah. Just looking at the medications, okay? So, and that's what a good healthcare provider should be able to do. That's why it's more important for you to know your medications than it may be if you tit for tat. If you don't know your diagnoses, at least know your medications, okay? What over-the-counter medications or supplements you take regularly, how often you exercise and for how long, how often you eat out, get takeaway or eat fast food. Now we know why, okay? That's a lecture by itself. If you've experienced any major life changes recently, such as a new job, marriage, divorce, a move, a new pet, etc., why is that number 5? Why is that in the questionnaire? Stress. Stress, 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 stress. A person who may have hidden that blood vessel plaque in their arteries, don't even know to the extent of the plaque buildup in their arteries, right? Stress on top of that can cause you to have a heart attack or a stroke. Yes, it can. All right, now I want to talk about this lady right here. This woman, and I'm going to read, her picture is on the cover of the magazine, okay? And I was trying to see if there was a date, of the magazine. I'm sorry. This is one of those magazines. This was 2024, actually, August of 2024, all right? It's an old magazine, but guess what? The information is still something that needs to be shared. So I'm going to read to you about this lady here. Her name is Olga Hall. Okay. And it says, this right here says, this is a silent disease that can creep up on you. Take it seriously. And she's talking about high cholesterol, hyperlipidemia. And guess what? She is a nurse practitioner. For nearly 3 decades, Olga Hall dealt with stubborn high cholesterol. So for 3 years, she did everything. She tried different medications, different this, to get her cholesterol down. It was so stubborn. Okay? And long story short, she ended up eventually finding out that she had a familiar hyperlipidemia. So FH is something that familiar hypercholesterolemia is a life-threatening hereditary condition that causes high cholesterol. And it's something that they don't just diagnose you with until you get like her situation, where she had tried everything and could not get her cholesterol down. So let me read to you her story. And this, to me, is the most significant part of to complete this lecture tonight, is understanding this, okay? So Olga Hall, she thrived on being on the go. When the 48-year-old mother of 2 adult children from the Baltimore area isn't working as a family nurse practitioner at her private healthcare business, and it's called Ananda Holistics and Wellness, she can likely be found engaging in one of her favorite pastimes, exercising. Okay, now, you have a woman who does not appear to be obese. I don't know her BMI. She loves to exercise. And she's a healthcare provider teaching other people or holistic wellness, right? There's no way in the world you're going to tell me that she didn't practice what she preached. I really look at her and believe she did. Okay. But she exercised. It in quotes, it says, I was raised in an outdoorsy athletic family. She says, we love bike riding and hiking, and my kids played in sports when they were younger, along with going for either a bike ride or a walk each day. She also lifted weights at the gym at least 3 days a week. So it may be surprising to learn that Olga had been living with cholesterol issues for almost 30 years. In fact, her health journey began in her 20s when she was told her total cholesterol hovered around 200. That is considered high, but not alarmingly so, and I was young, so I wasn't worried. Well, guess what? Her doctor, I'm sure, wasn't worried either. So I'm saying how important it is once you find out your situation to share it with others. Olga's blood work remained the same throughout her 30s. Eventually, her doctor prescribed a statin to see if that would pull it into the normal range. Now, that is cholesterol medication such as pravastatin, atorvastatin, those statin drugs, simvastatin, okay? And it said, unfortunately, I wasn't able to tolerate them, so I stopped. That is the main thing. There's a lot of people who cannot tolerate those medications, and they cause aches and pains in the muscles, and they that can happen, and there are many people who can't tolerate them. So you have to come up with another way of getting your cholesterol down. So this says that, she started a new job, had changed her insurance, and her insurance plan did not check her cholesterol levels. 4 years later, during a global pandemic, another insurance change allowed her to meet with her amazing pre-2016 primary care physician again. He called me at home and said, "Don't panic, but you need to come back to my office." That her cholesterol was officially considered dangerously high, with a total cholesterol over 400. Wow, that is critically high. And I didn't even know that the number was possible. She recalls thinking. Her doctor then referred her to a cardiologist. All right, moving forward. What ended up happening, the cardiologist recommended that she get genetic testing. And as a result of that test, she tested positive for inherited genetic changes known to cause familial hypercholesterolemia, a life-threatening hereditary condition. Okay? So my thing is this. Number one, when you are young, you have high cholesterol. The red flags are young, high cholesterol, exercise, not overweight. She didn't smoke, any of these things, and her cholesterol is difficult to control. I am not going to wait on someone suggesting testing. I am going to ask for the test. The same thing happened to me in regards to being pre-diabetic. I asked my doctor to check my hemoglobin A1C. The doctor said, "Your fasting blood sugars have been good. You know your insurance is not going to pay for it." What did I say? I don't care. I will pay for it. We spend money on, oh my gosh, I don't even want to go there. The things that we will spend money on. And I've said this before. We will go out on our birthday and we will have a delicious dinner. We may spend $200 on a meal. And a meal that you're going to eat, digest, and poop out. Okay? It may stay with you 24 hours before or 48 hours before you poop the whole meal out. And it's gone. So why not take $200 and pay on a test that may save your life, that may be life-changing for the rest of your life? It's your body. It's your life. You have one life to live. Spend it on something that may save your life and the lives of your family. Because this woman had children, right? So Olga now says, get your cholesterol in check. The first thing she said was read up on FH, familial hypercholesterolemia. The most important thing you can do for your health is educate yourself. She states, after being diagnosed, I wanted to read everything about FH. For starters, Olga learned that while exercising regularly and making healthy food choices are important for general heart health and overall well-being, these efforts are not enough to manage high cholesterol levels caused by FH. That's why it's so important to get properly diagnosed. Now, her situation, we know, was familial. But there are people who have high cholesterol, and because it is a silent event, it's silent going on in your body. You're not going to know that there's atherosclerosis in your plaque buildup in your arteries until it's too late. Once plaque calcifies in your arteries, you cannot go in unless, well, let me say this. They can go in and do an angiogram or angiography and try to root, we used to say, go in and break it up and open up, the arteries. But it increases the chance that that plaque could break off and cause a heart attack or a stroke. Okay? So I guess what I'm trying to tell you is it's a whole lot easier to avoid it than to fix it later. Don't take the chance. Just take the pill. Okay? If the doctor told you had high cholesterol, just take the medication. And look, pray over the medication, anoint the medication, and take it. And once you get your level down, keep it down. The doctor can wean you down off of the drug, right? Lower it to the absolute lowest level. And you'll be fine. Okay? You may be fine where you are. And depending on your family history, EKGs, having stress tests, those kind of things, do them. They need to be done. Okay? I am going to stop there because I want to end by the achy breaky heart thing. Okay? The reason why I chose heart disease and high cholesterol and tie it in with having an achy breaky heart, I wanted to tell you about the history of the song and what it means. Now, people have heard of this song. It was written in 1990, and I can't sing the song, so I'm not even going whatever. Don Von Tress wrote the song in 1990. It was first released in 1991 by the Marcy Brothers with the title, Don't Tell My Heart. Okay? Then later, this is what really made it famous, was Billy Ray Cyrus, right? Miley Cyrus's dad, in 1992. He sang the song, My Achy Breaky Heart, or whatever, okay? I can't sing it, I did not want to get into copyright wadatever and play it for you, right? Because that's how it is sometimes when you play music, and we had, I just didn't want to do that. But what is the song about, An Achy Breaky Heart? It is a man begging his former partner not to share the news of their breakup or mock him publicly, as his heart is already too broken to handle it. So why did I choose the song "An Achy Breaky Heart" to go along with heart disease and high cholesterol? Because people don't want other people to know they got high cholesterol. They want to eat like everybody else. Don't tell nobody. Or you yourself choose not to tell somebody. Your body is you may, I'm just saying, you don't want nobody to know that you have high cholesterol. You want to be like everybody. You don't want to, or you're going to think I'm unhealthy. You're going to watch what I eat. Whatever it is. It's something that people choose to hide because there's no signs of it. And guess what? Unless you get your blood work done, you won't even know you have high cholesterol. Now, checking your blood pressure and blood sugar is a different story because the proof is in the pudding. It's you get your blood pressure checked and you got elevated blood pressure. Check your blood sugar. Your blood sugar's high. Okay? Or you may not even check your blood sugar. Some people, won't even check their blood sugar. But the cholesterol, there's no signs of it. You might have symptoms of high blood pressure and symptoms of high blood sugar, but you do not have symptoms of high cholesterol until it's too late. You feel me? That's where I'm going with it. Let me make it plain. An achy, breaky heart. You do not want to share the news. Okay? The song also focuses on the anguish of a failed relationship, asking the ex to keep the details private. Eventually, you try to keep it private that you have high cholesterol. You don't want nobody to know. You want to, eat what you want to eat. You even tell yourself that everything you doing is keeping your cholesterol low. Well, I've been walking more. I've been this, that, and the other more, and I've been doing this more. But if you don't go get your cholesterol checked, how you gonna know? You even hiding from yourself. You trying to keep the breakup, the relationship, even from yourself. We do not want cholesterol to form plaque in our blood vessels, causing a blockage that once it is formed and calcified, what you gonna do? End up needing a coronary artery bypass graft or some type of cardiac stent put in to keep the blood vessel open. But the plaque is there. It's been there so long it's calcified, and you wouldn't even know it was there if you didn't get screening. Sometimes I've seen too many people go get a CT scan of the chest because of something else. Come to find out they have significant cardiovascular disease, atherosclerotic cardiovascular disease, ASCVD. And if you have atherosclerosis in your blood vessels in your heart, or if you have it in your legs, the odds are you may have it even any blood vessel in your body. Your renal arteries that supply blood flow to your kidneys, the carotid arteries that supply blood flow to the brain. Do something about it. You may not be able to get rid of the plaque that is already formed, but you can prevent more plaque from forming. That's right. This is February. It is the 17th of the month. This is our Heart Disease Month, American Heart Month, established way back in 1964 by Lyndon B. Johnson. And this was established after he had his first heart attack. But guess what? How about he had another? Years later, he quit smoking. And I think he started back smoking again. And the heart attack, I think the third one he had was his demise. Okay? But I thank God that at least he helped other people by establishing this heart healthy month that we recognize every year. All right. Well, God bless each and every one. I pray that this message tonight was a blessing to you. You can go back and, do your research. But I strongly recommend that you know your numbers, okay? Know your numbers and share information. Do that health screening, okay? And share that information with other people so that they will know. They will know. The people who need to know will know your heart health profile. To God be the glory. All right, blessings, blessings, blessings. We hope and pray that we see you this coming weekend. All right. Have a restful night's sleep. And I pray that the Lord will bless each and every one, strengthen you, heal your body, heal you from the crown of your head to the soles of your feet. To God be the glory.